Approximately 2 million women go into menopause each year, and one of the side effects is hormonal imbalance. Clark Hansen from the Hansen Clinic of Natural Medicine is here to tell us how to keep our hormones in balance the natural way. Welcome.
Well, thank you.
So, Dr. Hansen, why are so many people experiencing menopause earlier?
Yeah, it's really common. It's 2 to 10 years earlier now because of stress on the adrenal glands and environmental chemicals that are disrupting the endocrine system.
So what's the conventional treatment for early menopause and menopause?
So early menopause we call peri-menopause. So around the time, a lot of women get heavy bleeding, and they're having the mood disorders, the hot flashes, and ablation is given to scar the inside of the uterus. It really melts the inside of that uterus, stop the bleeding, but it doesn't change the hormones which cause all the side effects. The other one that in menopause they are using estradiol. Estrace is when we have the black box warning for estrace. You see this big warning sign, causes cancer, heart disease, strokes. You don't want to have those things happen to you. So
absolutely
the synthetic estrogens are the problem, not the natural. So we use the bioidentical hormones.
So how do you know if your hormones are out of balance?
Most women can tell right away. They don't recognize themselves anymore. My patient Carla is a good example of that. The symptoms that she was going through, she knew her life was upside down. The hot flashes, the night sweats, sleeplessness, brain fog, memory loss, anxiety, moodiness, weight gain. She'd gained 30 pounds in the last few years. Thinning skin, as well as, you can't really tell, but thinning bones, sagging everywhere, low sex drive, fatigue, hypoglycemia. So all of those things are multiple hormones, not just one, so it's multiple systems. So it's estrogen, it's testosterone, DHEA, it's thyroid, it's adrenal hormone, pregnenolone is the memory hormone. So we need to check all of those hormones.
And how do you check all those? Is that a blood test that you do?
It's a blood test that we do. The blood is the reservoir for all these hormones, very small amounts, but they need to be kept in the right balance. So we have a chart of the hormone deficiencies in this patient.
And these are all the things that you're going to be looking for in your clinic to help people get back on track.
Exactly. The optimal level, and then we see her initial level, everything was out of balance. Now she had that estrace, so the two estrogens, estradiol and estrone, were way high to begin with on her. And the second visit, within 3 months, we got them all back into optimal range.
Wow.
She was feeling awesome again. You get rid of all those symptoms.
And now you do bioidentical hormones. What's the best way to take those?
The best way is a sublingual dilution. So we have a 2-piece pull-apart capsule that combines the key hormones, estriol, progesterone, and testosterone into one capsule. Pull it apart and pour it under the tongue. In the mouth, it dissolves quickly into the bloodstream, it does its job, and it's replaced every day. The pellets create problems because they build up the estradiol, the wrong hormone. It sounds convenient, but it causes that increased risk of the wrong hormone, estradiol.
And you probably get a big surge at the top,
and then a big surge, then it wanes off, and you don't have enough. It's not consistent. Your body needs it every day. So the hormones are wonderful. This patient, after 3 months, well, actually within 2 weeks, her hot flashes had stopped. She was feeling better than she's felt in decades. Her sex drive was back. She says, I never want to go back the way I was feeling before.
Oh, yeah.
Energy's back, the thyroid's working, the adrenal's working, all the hormones are in balance.
She's a happy camper, and I bet her whole family is too.
And not only that, but she is going to reduce her risk of serious diseases.
Yeah, you were saying heart disease is another problem.
Heart disease, cancer, strokes, all those things are reduced risk by taking the natural bioidentical hormones.
Wonderful. You have a special offer for our viewers too, Dr. Hansen, right?
We'd like everyone to go to our website and learn more, but first 25 callers are going to get a half price off our new patient visit, half price off the advanced hormone profile that we're doing as well.
Wonderful. Well, Dr. Hansen, thank you so much for being here today.
Thank you.
If you'd like to get more information about the Hansen Clinic of Natural Medicine, you can visit their website, drhansen.com, or call the number you see on your screen.